Well, my name is Katie Metz, and I am with the National Disability Institute. Welcome to our 2012 webinar series. Today's webinar is sponsored by Bank of America and others at Walmart as well. If you're to the webinar, we're going to go over a couple of quick housekeeping points. Today's webinar is being broadcast through your computer. So your speakers are turned on or your headphones are plugged in. Control the audio broadcast via the audio broadcast panel. If you close that panel, you can reopen it from the top menu. Join audio broadcast. Sound capabilities on your computer or prefer to listen by phone, you can do by dialing 1-877-684490 with the note as you see on your screen 968-40-024, and you do not need to enter an attendee ID. In the lower right-hand corner of your screen, we have closed captioning available for persons who are deaf or hard of hearing, or where English may be a second language. Close it down if you don't want to see this by minimizing that multimedia window, or you can make the multimedia window with the closed captioning larger by minimizing the windows above it, the chat window, the Q&A, or the panelist window. If you experience any technical difficulties, please use the chat box to send a message to the host or Nakia Matthews. Just a quick, you can also, if you also are listening by phone, you can email cburke, B-U-R-K-E, at ndi-inc.org. I apologize if there's a little bit of an echo today. We were trying it out earlier and we noticed there was some echoing on our phone. So again, once again, technical difficulties, and we apologize, but we'll do our best to make sure that you can hear us as clearly as possible. Question and answer, chat box or the Q&A box, send your questions to, actually, I'm sorry, I apologize for, it's really Nakia Matthews. Ken Burke is my colleague with the National Disability Institute, and she is logged in with us today because Nakia could not be with us. I apologize for any confusion. So Caroline will be facilitating our questions, but for the purposes of the WEX system webinar, you'll send your questions to Nakia Matthews or the host, either through the Q&A box, again, or through the chat box. At the end of the presentation, myself or Ken Hamilton will answer any of your questions. If you're listening by phone and not logged into our webinar, you can ask questions by emailing them directly, again, to Caroline at cburke@ndi-inc.org. This webinar is being recorded, and all of our materials will be placed on the National Disability Institute website at www.realeconomicimpact.org. And my name is Katie Metz. Real quickly, I am a regional specialist with Real Economic Impact Tour at the National Disability Institute. I've been with the National Disability Institute for about 1.5 years now. Prior to that, I was manager disabled services with the City of Jacksonville Mayor's Office in Florida. So my background is in disability and ADA. I appreciate all of you logging in today. We hope that you'll find this webinar beneficial to the VITA sites and volunteers across the country. And we want to make sure that we do everything possible to equip you with technical assistance and resources to move forward when it comes to your VITA services. If you're not familiar with the National Disability Institute, we are a research and development organization, and our mission is to promote income preservation and asset development for persons with disabilities so we can build a better economic future for Americans with disabilities. Economic Impact Tour specifically is a program of the National Disability Institute, and our purpose is to build disability-inclusive free tax assistance, financial education, and asset-building opportunities across the country for persons with disabilities in partnership with our trusted networks across the country. We want to thank our sponsors who are with the National Disability Institute, which include Walmart, Bank of America, Incora, IRS, of course, Burton Black Institute, and the Institute for Economic Empowerment. Moving forward today, again, I want to thank all of you for joining us. I apologize, my voice is going a little bit. I've had a bit of a allergy sinus cold, so I will do some of the presentation today in my co-presenter Karen Hamilton. With that, I am going to turn it over to Karen to get started. Karen Hamilton is with the Southeast ADA Center, and her and I have presented in the past. And again, we thank all of you for joining us today. We welcome you. So with that, I will turn it over to Karen.
Yes, I am. Can you hear me?
Yes, we can. Thanks, Karen.
Okay, fantastic. Hi, I'm Karen Hamilton. I'm with the Southeast ADA Center. We are a project of the Burton Black Institute at Syracuse University. And to give you a little information about myself, I've been working with the ADA Center for over 10 years as an affiliate in North Carolina. And I work with grassroots groups and businesses across the state on Americans with Disabilities Act issues, training, and work with groups to promote voluntary compliance with the Americans with Disabilities Act. So today we're going to go over some things that the Americans with Disabilities Act ask, basically what they require of you as a VITA site, but also basically how to better serve or best serve customers with disabilities. So if we'll get started with our file, we'll start with statistics. There are 58 million Americans with disabilities in the United States. That's 1 in 5 Americans have a disability, and that's 20% of the population. 20 million families have at least one member of their family who's a person with a disability. Next, on the slide, you'll see that this is President Bush Sr. Signing the Americans with Disabilities Act on July 26, 1990. And CA has been around for a while, but it's how we still have folks that are new or still learning, or new businesses that still know about the law. Next, the Americans with Disabilities Act has obligations for businesses and you as VITA sites. Americans with Disabilities Act, businesses have some basic obligations when serving customers with disabilities. Most of all is equal access. People with disabilities who meet the qualifications to use your VITA site have the same rights to those services as everyone else. In our presentation, we're going to discuss facility access, access to goods and services, effective communication, and reasonable modification of policies and procedures. Next, the purpose of this presentation is to discuss common barriers at VITA sites, strategies for addressing those barriers, and resources that you can use to make your VITA site more accessible, and tips on working with persons with disabilities. I know many of you out there already serve many people with disabilities in your VITA site, and so I hope that when we get to the question and answer part of our presentation today that you'll share some of your expertise also. Facility access. If you get into a building and through the door, then you can't take advantage of the VITA site. People with disabilities should be able to arrive at your site, approach the building, and enter as freely as everyone else. And at least one route of travel should be safe and accessible for everyone, including people with disabilities. And many people say, well, we have a facility and our facility has to be accessible by the law, so we really don't need to worry about this. In fact, in many cases, it depends on where your VITA site is located. For example, your VITA site may be located in a church, or someplace in a church, for example, may or may not have to comply with covered by the Americans with Disabilities Act, or it could be an existing facility where maintenance issues have come up and the facility may have been accessible at one time, but there are barriers now. So facility accessibility is important, even if you don't own the building, to kind of do a view of your site before the tax season starts. Next, we have parking. Do you have accessible parking available? Many people that use VITA sites say the number one thing that really keeps them from coming is that they can't get in. There's no place to park, or they can't get through the front door. And if they can't get to the door or through the front door, then they may feel like they want to use the services. Accessible parking spaces for cars should be 8 feet wide with a 5-foot access aisle. Inaccessible parking spaces should be 8 foot wide with an 8-foot access aisle for vans with wheelchair lifts. And facilities have accessible parking spaces, but sometimes the access aisles, including the curb cuts, made by debris, such as snow, ice, leaves, and sometimes cars will even park in the access aisles, especially the water van accessible access aisles. It's important to look at your parking lot and that making sure that that even if there is an accessible parking space, that the curb cut is free from any debris and the curb cut is there, and that you can get from your car and get all the way to the front of the building. And you also want to check with your local building code to find out if their guidelines exceed what the Americans with Disabilities Act requires. 25 parking spaces, you should have at least one accessible parking space. And always have at least one van accessible parking space. So if you only have one, let's have 25 spaces at your facility, you should have at least one accessible parking space, and that has to be van accessible because you have to have at least one van accessible space. In larger parking lots, one that has more than 25 spaces, one of every 6 accessible parking spaces need to be van accessible. And that used to be 1 in 8, but it's just changed as March 25th, 2012 with the new ADA Amendments Act. So you have a very large parking lot and you have, let's say, a bank of accessible parking spaces. 1/6 of those accessible parking spaces need to be van accessible now. Other things to consider about accessible parking are the accessible parking spaces closest to accessible entrance? Your VITA services may be in the back of the building, for example, and perhaps that's the area that would be best to have accessible parking spaces at. It's depending on how person accessible entrance is into your building. Are accessible spaces marked with the international symbol of accessibility, basically the accessible parking signs? Parking spaces to create more accessible parking, that's fairly inexpensive, and there's some excellent ADA and parking publications available for you to use to help determine how to restripe parking lots. You can also create temporary accessible parking spaces with traffic cones and signs, especially for a VITA site that is only going to be in operation for a few months. It's reasonable if you feel you're going to need that additional accessible parking that you go ahead and mark off some temporary accessible spaces. On this slide, you'll see that we have an access to the 2010 ADA standards for accessible design. I have to just know that we have an excellent publication on restriping parking lots, but the Department of Justice has not updated it yet with all the new standards that were required by the 2010 ADA standards for accessible design. They went into effect in March, and so those publications are being updated. So I've only given you the link to the design standards. However, I urge you to go to the Justice Department website. They have DOJ. Just in your browser, just put DOJ ADA, and it will take you to their ADA homepage, and have some really excellent publications on parking. Fortunately, to repeat, they haven't been updated yet, but they're still, the majority of the information is current. Next, we have information about the accessible route. Is the route of travel to the building or entrance that does not require the use of steps or stairs. Is the route of travel stable, firm, and slip resistant? At least 36 inches wide. One easy way that we usually use to determine accessible exercise is just to take a yardstick, which is 36 inches wide or long, and hold it and just walk from the parking lot to the building, and you can find out right away if you have 36 inches clearance the whole way to the building. Examples of barriers on the accessible route to a building could include part of the walkway is gravel. Sometimes there'll be a beautiful accessible parking space, and you have to go through a gravel section to get to the accessible path of travel. Also, trash cans or leaves or debris can also be blocking that 36-inch path of travel from your accessible route. On the accessible route, can all the objects protruding in the route be detected by a person with visual disability using a cane? Some examples of barriers that protrude into an accessible path of travel, let's say from the way from your parking lot or the bus stop, it could be low-hanging limbs from trees, temporary signs. Let's say you put up some signs, direct signage to get into building and to direct people to the VITA site. Make sure that those are not on the accessible path of travel but to the side. And low-hanging outdoor lights, hanging and baskets sometimes can be a barrier for people who can't see them. Once you've gotten off the bus or out of your car and you've made it down the accessible route to the building, is there an accessible entrance? And there are stairs at the main entrance. Is there also a ramp or a lift, or is there an alternate accessible entrance? Many old buildings may not have an accessible entrance in the front of the building, or there may be a ramp to the side. But very important, do all inaccessible entrances have signs indicating the location of the nearest accessible entrance? In older buildings, the main entrance may only have steps, and often if the entrance is maybe in the back of the building, but if there isn't a sign in the front telling you where the accessible entrance is, folks know where to go. As the building next, as far as building entrance is concerned, can doors be opened with too much force? If the door has a closer, does it take at least 3 seconds for the closer to close? And many times all you need to do is adjust the tension on the door, or adjust the tension on the door in general to fix this problem. As far as Americans with Disabilities Act is concerned, as far as doors outside of buildings, because there are other conditions and factors that affect entrances across the country, there isn't one specific standard as far as how heavy a door needs to be from the outside, but it needs to be people need to be able to open it easily, or you need to figure ways that will assist people in getting in if they need it. Next, the accessible path of travel once you get inside the building. Once a customer with disability enters your building, there should be at least one accessible path of travel to VITA services. This accessible path of travel should be at least 36 inches wide and not require the use of steps or stairs. For example, if you go into the building and the services are on the second floor, there should be an elevator so that you can get to those services. Accessible. Next, we have more information about the accessible path of travel. In the circulation path, or the path that you would take to get to the VITA services, are all the obstacles cane detectable for a person who is blind or has low vision. And a protruding object is not an obstacle for a person with visual disability using a cane if the object is located within 27 inches of the floor, because this can be detected by their cane. If the object is higher than 80 inches from the floor, because they can walk under it, or if the object is less than 4 inches from the wall. So, for example, a fire alarm, sometimes those will protrude about 2 inches. That wouldn't be an obstacle. But a display cabinet, as you see in this picture, that sticks out to more than 4 inches, it needs to be situated so it is cane detectable. As far as cane detectability is concerned, maintenance of a building is really key. Keeping plants trimmed back, making trash cans and furniture are not placed in the accessible path of travel are examples of good maintenance. In summary, good facility access benefits everyone. It allows the person with a disability and other adults to either travel from the parking lot or the drop-off area to where the actual VITA services are being provided inside your building. Small children and baby strollers, delivery workers, staff carrying packages also benefit from good accessible design, and it makes your facility safer for everyone. Talk some about effective communication. Accessibility not only applies to your building, but it's also how you provide those services. In fact, effective communication is probably key when it comes to VITA services and people with disability taking advantage of those services. Public-private entities must take steps to ensure that their communication with people with disabilities are as effective as communication with others. The way in which we interact and communicate is important, and knowing a little bit about persons with disabilities and the disability etiquette when working with the public will help ensure success in serving people with disabilities. I'm going to turn this over to Katie and let her go over a little of some tips for working with people with disabilities at your VITA site.
Thanks, Karen. So a few of these tips, many of you may have seen these when we went over, if you've gone over our disability training that we have on our virtual toolkit on our website. However, I think it's always important that we go over these, and I encourage you to share these, of course, with your volunteers as well, for those that are participating in the VITA sites. One, of course, when you're talking to a person with a disability, look and speak to them directly rather than through a companion who may be with them. And again, a lot of these, as I'm going through them, are what many of us would consider common sense tips. However, I have learned through my many years in the disability field, going on 15 years of work now, things that we often take for granted, as common sense, are things that I think if we point to individuals, they may not even realize they're doing. So again, if you're using an interpreter that's present, sign language interpreter, or even someone using a language other than English and using an interpreter, we of course want to speak to the individual who has come for the services, not the interpreter. And it's always important to maintain that eye contact with the taxpayer, not the interpreter. I like a quick example when I say about speaking directly to individuals. My baby sister has had rheumatoid arthritis since she was younger and has been in and out of a wheelchair. And so we would go to amusement parks, and for those of you who she could transfer into a ride. And when we'd go up, the attendant would often look at me pushing the wheelchair and ask me, "Can she transfer?" And I would say to them, "Well, you'd ask her." And that's just a quick example of the way, individuals don't quite realize that they're doing something. So again, just reminding everyone to speak directly to the individual, not necessarily the companion or interpreter that might be with them. Secondly, people with limited hand use or who wear an artificial limb can usually shake hands. So it's always a good rule of thumb to offer to shake hands. Shaking hands with the left hand is absolutely acceptable, and it's always one to follow the lead of the individual. And maybe for those who cannot shake hands, touching the person lightly on the shoulder or arm to welcome them is acknowledging their presence, and is for the most part is acceptable. It's reading the individual and what they're comfortable with. Greeting a person with a severe loss of vision, always identify yourself and others who may be with you. So when you're conversing in a group, for example, It's wonderful if you could give a vocal cue by announcing the name of the person to whom you're speaking. I know I speak, just like when we're on conference calls. Often when I'm in a large group and may have individuals there who are blind or low vision, I begin to speak. I just become a habit that I'll say, "This is Katie," and go forward with what I have to say in a normal tone of voice, indicating in advance when you're going to move around from one place to another, and let an individual know when the conversation is at an end rather than just leaving them in the lurch. Again, that's very common for someone who has low vision or who may be blind. Another is offering assistance in a dignified manner with sensitivity and respect, being prepared to have an offer declined, but also being able to offer proceed to assist if your offer is listen to and accept their instructions. So allowing a person who has low vision or blind to take your arm around the elbow is perfectly acceptable, and enable you to guide them rather than propel or lead or jerk the person around, again, following cues of the individual with a disability. Calling a person by his or her first name, treating adults as adults. So you would call a person by his or her first name when extending that familiarity is to others present. You want to patronize individuals using a wheelchair, of course, by patting them on the head or shoulder. That simply goes with, treating adults as adults. As saying not leaning against or hanging on someone's wheelchair. And whenever it's possible, putting yourself at eye level, sitting in a chair next to an individual to have a conversation is always a great rule of thumb. The wheelchair or any other type of mobility device that an individual uses is part of their space, and it belongs to the individual who uses it. So just as we would not lean on someone else, we wouldn't lean on their wheelchair, or we wouldn't want to take away their mobility device, thinking, "Oh, I'll take your walker and I'll put it over here." It's not really acceptable. I know that sometimes we have the best of intentions, but again, I can't stress enough asking the individual their preferences and placing yourself, in a situation where you're either eye to eye with them to facilitate conversation or asking permission before, trying to help or doing anything. Listening attentively when talking with people who may have difficulty speaking, waiting for them to finish their sentences. Excuse me. It's important, to keep our manager encouraging rather than correcting. So if you have an individual who may stutter or have difficulty getting their words out, the is to exercise patience rather than attempting to speak for them, which I know can sometimes be our first inclination. But when necessary, it's wonderful you can ask short questions that require short answers, or a nod or a head shake, so that you're not prevented from or pretending to understand them or making them, give out long sentences. It's just, again, working with that individual on what is for them and asking questions when necessary. It's important to never pretend like you understand them if you don't. Maybe reading back what the individual may have said so you can incorporate their statements into any questions you might have. And then following their reaction, we want to make sure that, when we're working with individuals that we're getting the information correct, especially when we're working with tax preparation. Tapping a person who has a hearing disability on the shoulder or waving their hand to get their attention is acceptable. You should look at them directly and speak clearly. If an individual who reads lips, make sure that the individual sees you and knows that it's not exaggerated movements, lip movements, or exaggerated wording, but you're doing it slow, keeping your hands away from your face and allowing them the ability to be able to see what it is you're saying. Not all individuals who are hard of hearing or are deaf can lip read, but some rely on facial expressions and other body language to help in understanding. So I always say please show consideration by facing them in a light source and keeping your hands and free from your any distractions. We do, of course, shout at a person who is blind or low vision because more than likely they can hear you, and sometimes, again, that seems like common sense, but often find individuals doing such a thing. To facilitate conversation, be prepared to offer visual cues, individuals who are hard of hearing or deaf, or an audible cue for a person who has low vision or is blind, especially if you have more than one person speaking in a group setting. And it's also important to remember that expressions like "see you later," self, and not be embarrassed if you use such common expressions for an individual who might be blind, or with you for a person who's a wheelchair user. Those are common expressions and they're perfectly acceptable. I've had individuals who would come up to me who were not familiar with the disability community after. They're like, "Oh my gosh, I can't believe I said that." It's perfectly acceptable. Excuse me. And we want to stress that individuals use people first language. Language, a lot of individuals, it's just words, but I know the old saying about words hurting. And the way that we communicate with individuals and the way we work with individuals is often expressed through our language and the words that we use. So it's important to remember that people with disabilities are not conditions, they're not diseases, they're individuals and they're human beings, and that language helps to foster effective communication. For example, a person who has epilepsy, they're not epileptic. Or first and foremost, they are individuals. Many people dislike the jargon handicap, crippled, challenged. Things that the sense, again, it's the individual person, a person who uses a wheelchair, or a person who is blind or hard of hearing. We often use the wording, if you take the ED out of your language, you're probably doing good. For example, not a person who's visually impaired, but a person who's low vision or blind. And we use the wording wheelchair user rather than confined to a wheelchair or wheelchair bound. It's just that individual happens to use a wheelchair. Another thing we like to talk about is not getting swept up in stereotypes. People who have vision or are blind may wear glasses. Doesn't mean that they're faking it, which I've often heard. Or people who are deaf have very excellent speech and read lips, but not everyone does. People that use wheelchairs may or may not be completely blessed. They may be able to transfer. There are individuals who have hidden disabilities. There are individuals who have delayed and slow speech, but that doesn't mean that they have a slow mental process or have trouble understanding you. It may just be that their speech is slow. Disabilities don't necessarily want or need assistance. Again, the best rule is always to ask first and ask how you can be assisted. Persons with disabilities come in all ages, cultures, and financial backgrounds. And we always like to set is the one demographic I think that any one of us could join at any time when it comes to a minority demographic. Effective communication is so important in everything we do. Auxiliary aids and services, of course, are devices that enable this effective communication. By providing effective communication, we often have to provide those auxiliary aids and services. It can be anything from language interpreters to large print to larger pencils. A lot of times what I hear as I talk to tax coalitions around the country, I think the number one fear is the expense of auxiliary aids and services. I really try to stress to our partners around the country that, one, we make sure that the community out there knows that you're willing to assist in any way possible. So there's a good point to ask everyone, have you placed accommodation statements on your flyers? Have you put them on websites so that individuals know where and how to contact you if they need an accommodation? We have a wonderful effective strategy in our virtual toolkit on our website that talks about accommodation statements and gives you some good examples of accommodation statements. You can have long accommodation statements if you have plenty of room, like say on a website, where you want to say, we actively encourage the participation of individuals with disabilities and will provide accommodations by contacting such and such. Again, that's a long statement, but if you're really, really wanting to do an outreach to a disability community, a certain group, they're actively saying, we really want to encourage you to participate. We're going to do everything we can to make that possible. But if nothing else, if you at least have an accommodation statement that says something to the effect of, for more information or accommodation statements, please call. So you see there, you're already going to have a contact phone number. You're probably already asking them where you get more information. you give them that simple statement or for accommodation statements, the disability community now sees or hears or understands, okay, I'm going to be welcome at your VITA site and I'm going to be able to participate. The individual may not even need an accommodation, but what I've heard and what many of us have heard from the disability community is that they just want to know that they're going to be welcome there. And that simple statement allows them to feel as though they are going to be welcome. Quickly getting back to, again, costs and fear of, oh my gosh, what if somebody asks for an accommodation and I can't fulfill it? Well, we are required by law to fulfill accommodations. And if you need assistance, you are welcome to call one of your technical assistance liaisons, myself, my coach Jeanette Hartnett, or our program assistant Caroline Burke, and we will absolutely assist you in any way possible in trying to find a network or an accommodation in your area that will help. Often, it can be something as simple as, like I said, I need a larger pencil, or I need someone to help me filling out a form, or I may need something in large print, which really could just mean blowing it up on a copier into, enlarging the font on the Word document. Something that's very simple and something that you can work together to find out what the easiest accommodation is for that individual. Again, when we talk about effective communication, we want to talk about, my voice going a little bit. We're doing the simple things for individuals who might have low vision or blind. And again, that could be large print materials, braille materials, things that audio materials in electronic format, reading information aloud to a customer, or providing assistance in completing their forms. What to keep in mind is that good lighting is extremely important for people with low vision, and make sure that your VITA services are an area with good lighting can prevent that need for an accommodation. And I'm sure it's quite easy if someone's needing that accommodation. And also to keep in mind really quickly is that, if you have gone through an expense of purchasing some type of equipment, that accommodation, make sure that the public knows so that they can take advantage of the services that you are providing. Effective communication when it comes to auxiliary aids and services for people with hearing and speech disabilities can be something as simple as located services in areas with limited background noise. That's particularly helpful for individuals who are both hard of hearing, but also for individuals in general. As we know, it's much easier and calmer, and people concentrate better when you're in an area that's quiet. And I know that's difficult sometimes when you have a VITA site and you have a lot of different individuals. If nothing else, if you have a couple quieter areas for individuals who may be, hard of hearing, so that you can put them into that space, have a better time understanding you. And auxiliary aids, of course, is the range of written notes, instructions, other information in written format that you have available, on a computer, text messaging, assisted listening devices, of course, qualified interpreters. I always want to make sure we have the best resources available for the individual asking for them. A few quick tips on gaining the attention of or working with individuals deaf or hard of hearing. Of course, gaining their attention, starting their conversation, perhaps tapping them on the shoulder to make sure that they know that you're speaking with them, looking directly at the individual, facing the light, speaking clearly, normal to voice, speaking slowly, but not so slowly that it's exaggerated. If the individual happens to be lip reading, some people who are deaf speak clearly, and then others are nonverbal, and understanding that if they're using a sign language or perhaps they do read lips, they do have some are verbal, that sign language is a different language, and it's spoken, in different formats. There are different types of sign language. American Sign Language, often individuals, it will be like, I'm going to the store, and in sign language it's store, I go, because it's an abbreviated language using hands. So often individuals who are deaf or hard of hearing and who use American Sign Language, sometimes, not always, but sometimes when they're writing notes, the note may come across as the English or the grammar is not up to par. It's not necessarily indicative of the individual's intellectual abilities, but it just is a language as if someone who spoke French or Spanish and did not know English and had broken English was trying to write and communicate. So just keep that in mind as well. Individuals who have speech difficulties, if you don't understand, again, if something the individual has to say, then that you do. Just ask them politely to repeat themselves, and then, if necessary, have them repeat it back to you, taking your time and being as patient as necessary, concentrating on what the individual has to say. And like I said before, not attempting to finish his or her sentences, but really understanding the individual, consider writing down perhaps as an alternative means of communication, but asking them if that's acceptable to them and really only as a last resort. Again, effective communication, when a person with a disability requests an auxiliary or an aid, we really need to try to consult with them about what their choices are and what their choice of aid or service might be. There are more than one option out there that will work for both you or them, but the individual is going to know what works best for them. And it's okay to ask them, what is it that you would prefer, and have an alternative in mind that is somewhat close. It's okay to say to them, would this work? And have a conversation about that. But you always do have to remember that businesses can't charge the person for the communication, aids, or services being provided. It is the responsibility of the business providing the service. The thing I want to go over quickly is policies and procedures. And it's so important for policies and procedures for serving persons with disabilities at your VITA site. Because if your policies and procedures aren't in place, it can greatly impact the accessibility for people with disabilities at your VITA sites. We also want to take that one step further. If you have these policies and procedures in place, make sure that your site coordinators and your volunteers are aware of your policies and procedures. Because what often happens, of course, is policy, and I think this goes for anything, not just when you're working with people with disabilities, but we have policies and procedures and manuals, and they're sitting on our shelves in our offices, but staff and our managers out in the field, in the site, in the tax coalitions, the tax sites, may not be aware. So how is it that you process an accommodation request from a customer with disability? And is your staff aware of who they call to process that accommodation? Because you may have someone that walks into a VITA site and, let's say, deaf, hard of hearing, they need an interpreter. They ask the volunteer who's at the front desk, I need an interpreter to write it down. They're trying to communicate, and the individual has no idea how to provide an accommodation, and they may turn that individual away. Not only have they turned away one of your customers, and you may have place, you have everything you need for an interpreter, but you've turned a customer not knowing because your front desk person didn't know how to process that accommodation. And two, they're going to go back and tell the rest of their community, possibly, that they don't want individuals who are deaf or hard of hearing at that tax site. So so important, that's just one example of make sure that only that you have policies and procedures in place prior to starting your tax season on how do you process an accommodation, but so important to make sure that your site coordinators and your volunteers know what those policies and procedures are. At the very least, they know who to go to ask those questions. So I stress that enough, and I know I say that over and over, but I see so often is that there may be something in place, but again, that frontline staff doesn't necessarily know about it. So that is why it's so important that we educate and train all of our volunteers about working with people with disabilities and how we accommodate individuals if necessary. All the VITA workers have been informed about the VITA site's accessible features and accessible customer service practices. For example, your VITA site might have assisted listening devices, or they have another piece of equipment for people with disability to use. A great example of that might be used to, it's an older building and you have steps up to your front door. However, there's a sign and there is a lift around the side. But no one in the site's actually been trained how to use the lift. So you may have fully accessible features, you might have the right signage, but that comes down to it. Unfortunately, the volunteers may not have been trained on how to use that lift. So you just want to make sure that if you have accessible features in place, that everyone is aware of how to use those features and how to connect with individuals if they have questions. For examples of reasonable modifications of policies and procedures, Maybe, of course, I'm sure VITA sites and many places of business say no animals. So make sure that they understand that service animals aren't pets, that service animals are allowed and required by the Americans with Disabilities Act to be allowed into a business. Another good example might be food and drink. They might be prohibited at your site. Maybe you're a church or somewhere that doesn't want food and drink. But you might have an individual with diabetes coming in and they have to carry, a snack or something in their purse in order to get them through, especially if they're waiting in long lines or for their next appointment. Extended appointment times. Your policy in that site might be, 6 minutes, you're done. But then you have a person who has effective communication needs, and they might need an extended appointment time. All signatures, if you have a person with a physical disability that prevents them from actually, signing out a full signature, an alternate way may be X, because that is how they sign their name. So just making sure that you know that there's times when you may have to make a reasonable modification to your policies and procedures, and once again, that the staff and the volunteers are aware of that. Here are some really quick do's and don'ts when it comes to service animals. I am not going to go through them all because we are really short on time, and I want to make sure we have plenty of time for questions and answers. So again, this PowerPoint will be available on our website. But very quickly, just keeping in mind, and I always get so many questions when I do disability sensitivity training when it comes to service animals. So if there's something that's not covered here or you have other questions, you are welcome to email myself or even Karen. One of us would be happy to answer any questions when it comes to service animals. And like I said, I know that's always a big one in years as I've done disability sensitivity training. But the thing to keep in mind, most importantly, is the rights and responsibilities when it comes to service animals. It is a responsibility to allow service animals into an establishment, and it is the responsibility of that service animal owner to control that animal and to keep them, on leash and under control. There are acceptable times when a service animal can be asked to leave, but it is only when the service animal is out of control or the individual is unable to control that service animal. So, and one other big myth that I like to talk about is that service animals are not required to have proof that they are service. There's no ID that's issued for the Department of Justice or anything like that. So, again, if anyone has questions, you're welcome to contact me at a later time. Quickly, I want to go over a few tools that we have available through the REI Tour. One is the Tax Access project. A lot of people, we've been trying to get the word out the last couple of years about Tax Access. Karen and I have worked on this project for the last couple of years, and it is a safe place where VITA volunteers, coordinators can ask questions and find resources on how to serve people with disabilities more effectively. It focuses on disability issues related specifically to VITA services, including facility access, program accessibility, and customer service. We have the website here, and there's a toll-free number. Like I said, this website actually gives you an outlet to download resources and materials, specifically VITA sites. There's a form on there where you can ask questions. It will go to one of our partners at the Southeast ADA and give you response, usually within 24 hours, one of the ADA experts. You can also call the 1-800 number here listed, 1-800-949-4232, and someone will call you back within 24 hours. If you let them know you're a VITA site, that's the most important thing, or that you're with the VITA project, so you will receive priority to receiving a response to your question. And this Tax Access project is in partnership with Burton Blatt, the REI Tour IRS, and our Southeast ADA Center. Just an example of the web page. I know it's a little difficult to see. It's a screenshot, but kind of gives you an idea. There's a frequently asked question page, publications that are available, training resources, and again, a page to actually ask your questions, and you'll receive a response from one of our experts. If you go to our REI Tour page, again, realeconomicimpact.org, and you'll find our resource virtual toolkit. We have a number of tools there that are available for building your disability initiative. The series is as an example of what we're doing today and what we do every month. Our Tax Access project, there's disability awareness training. If you have not already saw it, we have a PowerPoint there that you can download and use in your training for your VITA volunteers. example disability outreach flyers that you can amend and make specific to your coalition or to your tax services and send those out. Effective strategies, as I talked about earlier, we have some on, how do you find a sign language interpreter? How do you process an accommodation request? And if you don't see what you're looking for there, please email one of us, and we will both answer your question, and you have a great resource for us to develop a new effective strategy. 30-second trainings that can be placed on our on your desktops at your VITA site, so people can take and they really are. They're quick 30-second trainings that you ask a question, and it allows people to learn more about what's going on when it comes to disability services. And then there's our REI Tour listserv that we encourage you to join and share information and be updated on information that's happening. I am going to turn it back over to Sharon. I'm turning it back over to Karen, as my voice is kind of going out. Let her go over these last few slides with you. So, Karen, with that. Are you there?
Yes. One of the important things I'm sure you're already doing is establishing partnerships, especially when it comes to serving people with disabilities. Make contact with disability organizations in your community. They're an excellent resource for information, and they're also excellent for reaching out to people with disabilities in your community. Examples of possible partners might include disability-specific organizations such as your vocational rehabilitation offices, services for the blind. The ARC is an excellent organization to be in touch with. Also, area agencies on aging. And one thing that we have found very, very helpful is collaborating and establishing partnerships with Centers for Independent Living. A local Center for Independent Living can be an excellent resource for making your programs and facilities more accessible to people with disabilities, in addition to encouraging people with disabilities to take advantage of the VITA sites. I know that here in North Carolina, we at least have a few of the Centers for Independent Living who actually volunteer to be VITA sites so that they can be assured that there's an accessible facility location for people with disabilities to get to, in a place where people with disabilities already know how to get to on the bus stop, through bus stops or whatever, and so can often be a very good partnership. Also, there are many IRS accessible tax publications. The web link that's here listed on this slide, and you will have access to these slides later. That particular document, and has all the different tax forms. They're also ready for Braille and also ready in text formats. Some people who use screen readers may need the forms in a format that the computer can read for them, and so those forms are already set up for that. Another thing that you may want to take advantage of, especially for you or your volunteers, would be the service welcoming customers with disabilities web course, and the address is www.wiawebcourse.org. And this is a product of the Southeast ADA Center, and is an excellent resource just for the basics on serving customers with disabilities and covering many of the things that we've talked about today. Next, if you still have questions, again, Katie had mentioned this earlier, but you can contact Katie, and her contact information is listed here, and you will have access to this information. Or you can contact me at the Southeast ADA Center or one of our ADA specialists. You can contact us in a few ways. First is our 800 number, 1-800-949-4232, and or our website. In the Southeast ADA Center website, I know that as Kate told you earlier, there's so many resources available on the economic impact website.org, but there are also many ADA resources, additional ADA resources available on www.aada.org. adasoutheast.org. And if you have any other questions, you also can contact us through the Tax Access website, and that address is listed on the slide, and you'll have access to that later also. I want to let you know that if you go through the Tax Access website to answer your question, that your question will go to the top of the queue, so you'll get priority, particularly during tax season. And I
think that's Karen.
That may
Katie?
be it.
Katie? Yeah, so we only have just a few minutes left, but go ahead and entertain any questions there might be. We'll stay on a few extra minutes if anyone else needs to, log off. Completely understand. So one quick question I know that keeps coming in is, where can you get the PowerPoint? It was on there today. I know we had a lot of links and resources available in this PowerPoint. It will be available on our website, and realeconomicimpact.org. And if you go to the REI Tour website, under our webinar page, we will post both this PowerPoint along with our recording of today's presentation. So you're welcome to take that and share it with others. You'll also be able to find on the same website, under our virtual toolkit, our disability sensitivity training and some other wonderful tools we would love to share and share with your volunteers. Another one I believe I saw was about asking about accommodation statements. If you go to our realeconomicimpact.org website and go to our virtual toolkit, under effective strategies, we do have an effective strategy about accommodation statements that will give you sample accommodation statements and an explanation of how to utilize accommodation statements. Excuse me. And if you still have questions, you're welcome to call me. The phone number is my cell phone, my work number, or my email, and I will answer you just as quickly as I can. So with that, Karen, do you have any additional questions that we could answer that have come in?
I do have a couple of questions that have come in, and thank you everyone who sent in questions. The one that came in pretty close to the beginning was asking kind of for a basic breakdown of some of the major groups that might require accommodations. The hope of this person was that they might be able to have more effective outreach if they had an idea of some of the populations that are most frequently served through these accommodations.
Karen, do you want me to address that, or did you want to?
I'll be glad to address it, and you can add any others.
Sure.
I'd say that the major would be people with physical disabilities, people in wheelchairs or with walkers or other type of mobility disabilities, people who are deaf and hard of hearing, people who have visual disabilities, including people who are blind or have low vision, all people with intellectual and developmental disabilities will also be some of your major groups. Katie, any others to add?
Come to mind off the top of my head is perhaps individuals who, like Miami, National Alliance for Mental Illness, individuals who I don't think you mentioned them, mental illnesses, hidden disabilities. I suggest going to facilities, perhaps in your community, or support groups who serve individuals with disabilities, their families, and their caregivers, and organizations as well. There are probably some others out there. If you have any suggestions, you're welcome to call us or contact us, and we can give you specific national organizations that you might be able to contact in your local community. Any other questions?
Yes, kind of going off of that, one person wanted to know if they were obligated to provide an ASL interpreter for a client who is both deaf and illiterate.
Sorry, voice is going. So if an ASL interpreter is requested by a person who would be deaf, then yes, it is required that you provide that accommodation for the individual. And assistance on how to select an interpreter or find an interpreter, or with agencies who provide interpreting services, we would be happy to assist you in figuring that out. And we do have an effective strategy on selecting an interpreter. Karen, if you have anything that you wanted to add to that?
That would be the answer I would give.
Great, fantastic. The next question that we received was just, are there any recommendations of websites where their accommodation statements could be viewed? Some people were interested in getting a better idea of how those statements are placed on materials so they could be the most accommodating to their customers.
So if you go to our website under the virtual toolkit, there's an effective strategy that gives specific examples of accommodation statements, as well as information on how and where to add those statements. And if it doesn't answer all the questions, you're again welcome to contact me directly. And I've also often worked with different coalitions or different agencies to help them adapt accommodations to fit their websites or flyers or whatever materials they might have, and I'd be happy to do that.
Carrie, do you have anything to add to that?
No, was a very. Those are very good resources. So I'm encouraging people to use them.
Fantastic. And then the last question that came was from someone wondering if the presentation that was given today qualifies for an accounting CPE. And I don't really know that there's any crossover between those two, but I wanted to double check.
So we do not have the ability to offer CPE, CEUs at this time. However, if someone wanted confirmation, we have had individuals contact us that they wanted confirmation that they attended the webinar, and sometimes they're able to submit that along with a copy of the PowerPoint to fill some training requirements. We're happy to do that. If you contact me via email, I can respond whether you have attended the webinar and a copy of the PowerPoint as confirmation. I think is the question?
That's it.
Great. So I'm going to kind of wrap up. I know we went a few minutes over. I want to thank everyone today. Again, we thank all of our sponsors who make the work we do entirely possible. I wish you all the very best of luck with the 2013 season coming up soon. If you have any questions, of course, please contact one of us. You have our contact information. The PowerPoint that was discussed today, along with the recording of the webinar, will be on our website and will be sent to you as well. Usually when you out, you receive it from Wes. And again, we encourage you to participate in our next webinar. They're every month. The next one will be September. You'll receive an invitation soon. It will be on Go Direct and the importance of bank on and those initiatives happening, and the date will be coming out very soon. Again, thank you to Karen and Caroline for your help today on the call, and we thank everyone and wish you the best of luck. Have a wonderful day. Thank you so much.